Good morning to everyone. We'll start the session. So we have been discussing about the different type of therapies that can be used to treat the psychological diseases, so different mental illnesses. So we were discussing about the psychotherapies. So I think 1 week earlier. So I think you can recall the content that we discussed. We have been discussing about the psychotherapies, different type of therapies or different type of methods that can be used to treat the mental illnesses or emotional difficulties. So basically, we were discussing about how to eliminate or how to control symptoms. Most of the times, as we discussed, we were unable to eliminate. Eliminate means we get rid of everything. We push away all the symptoms, but it's very difficult to eliminate the symptoms, but we can control the symptoms and we can manage the symptoms or the disease. That is the nature of this mental illnesses. So we have to remember it. This therapeutic side takes much more time to treat the people. So people should have that idea. And in this treatment side, we should know that the person can function better and can increase well-being and healing. So that is the expected outcome from this therapeutic side. All type of therapies. I discussed different type of therapies. So I just recall. So used in combination with medication and other therapies. So I told you that we cannot directly rely on only on the medical treatment. Medication means medical treatment. Instead of that, we need to concentrate on the behavioral treatments. So behavioral therapies, behavioral treatments such as counseling, etc. So this was the basic concept. Basically, we need to keep the trust on the treatments. If we want to get proper treatment, keep proper cure from the mental illnesses, we need to maintain trustworthy relationship between a person who is suffered from the mental illnesses and with the therapist. It is very much essential. So this is one main thing. So we need to maintain the relationship. And as I mentioned throughout the session, the psychotherapy is used combination both medication and mental counseling. So these two type of treatments work together to treat the mental illnesses. So and medication and counseling. So I have mentioned one more important point when it comes to the therapeutic side, therapies or the treatment side. It's very, very important uh, maintaining a healthy lifestyle. Healthy life, if we can maintain good nutrition, regular exercise and adequate sleep, most of these mental problems, we call it negative mentalities, where some psychosis or neurosis diseases can be managed or reduced, or we sometimes we can eliminate. Eliminate means we can uh, push away those illnesses. So it is very, very important, and it supports us to get 100% recovery of the overall wellness. So we need to keep it in our mind. Good nutrition is a very so we have to have healthy or the balanced diet, healthy diet, uh, having all the sufficient nutritious. It is very, very important when it comes to the psychotherapy, and you have to, not only you, actually we have to maintain our what we call the healthy body. So healthy body support to maintain the healthy mind. So this so we have to engage in regular physical exercises. Regular physical exercises will support us to maintain a good kind of nerve and all the biological uh, malfunctions will be removed. So this regular exercise support our body to function regular. So this is also a very good thing. And we need to sleep well. Adequate sleep. Sleep is very, very important to maintain our mentality and our behavior smoothly. So if we do not get adequate sleep, it causes a different or the different type of mental illnesses. So you may not concentrate on the things that you have to concentrate. So they are. It is a very what we call it is an important point when it comes to the mental health. So if you are suffering with some problems, it's very difficult to concentrate or difficult to close your eyes. So adequate sleep is very, very important at that way. Okay, and we will discuss these things, benefits of the psychotherapy. So symptoms relief, better able to function their life, so they can function their day-to-day life, and they can improve the emotions once they get the treatments from the psychiatrist or the psychologist, and positive changes in the brain and the body. So we can uh, get the support from the therapies to change our biological malfunctions, biological reasons, and it can be reduced the sick days. It can be reduced the sick days and less disability, fewer medical problems, increase work satisfaction. So if we feel that we are not okay, or our mentality is not okay, then we want to check, or we want to get the support from mental health professionals. So there are different counselors. Mental health professionals means psychiatrists, counselors, and psychologists. When it comes to the counseling part, when it comes to the counseling part, there are different type of counselors, family counselors, or educational counselors. Likewise, there are different parties that we can get the support. And we were discussing about different type of approaches. Approaches means different type of ways that we can use to treat mental disorders. Different approaches. That is the meaning of this approaches. So, if you can remember, there were some different approaches, different definitions for the mental disorders. You know, the similar names were there. Psychoanalysis definition was different. Behaviorist definition was different. Likewise. So here also we can use different approaches to treat mental illnesses. So I have mentioned here 4 main approaches: psychoanalysis and psychodynamic approach, behavior therapy, cognitive therapy, humanistic therapy. So we will see one by one. I think I have explained this psychoanalysis therapy. So here, when it comes to psychoanalysis, so they try to analyze our mental status. So the main person was Sigmund Freud. So psychoanalysis is his school. If you can remember the 5 schools, psychoanalysis is the one of schools, comes under the different schools. So Sigmund Freud is the person who led this area. There, they try to understand our mentality. So, if you can remember correctly, we discussed 3 types of mentalities. So, conscious level, unconscious level, and the subconscious. So, the psychoanalysts believe that what we call unconscious layer of our mind will create a lot of fuss. So the problems to our mentality, unconscious. So then here they explain the childhood experience and inappropriate thoughts. Childhood experience and inappropriate thoughts will in the unconscious mind influence to our thoughts and the behavior. That is what they believe. So they use 3 different words: ego and superego. So they are mental well-being influenced by childhood experience. Childhood experience means the experience you had in your from your birth until the day will be a reason for the mental disorders. That is what they told. Ego and different mentalities called ego and superego. So these different mentalities will cause the problem. And focus on changing problematic behaviors, feelings, thoughts by discovering unconscious meanings and motivation. So we have the unconscious meanings, our unconscious things are there in our mind. So these unconscious things, if we can focus on the unconscious things into the conscious level, so if we can discover the unconscious matters, then we can get the relief from the mental diseases. That is what the psychoanalysis taught. So they use that introspection. Whether you can remember the word introspection. So I use this similar picture to explain introspection. So introspection method was the method or the treatment way that they used. Psychoanalysis used this introspection method to treat the mental diseases or mental disorders. So here you can see patient. This is a patient, and here there's a therapist who takes notes what the patient is expressing. So therapist record almost all everything what he expressed. So expressing their mentality or their thoughts. This psychoanalysis believe that the patient can get some kind of relief, because they believe the unconscious, we can get the unconscious things into the conscious and subconscious layers, and it will support us to feel some relief. So they wanted to improve self-awareness using these methods, and they by getting unconscious matters into the conscious layer, they believe that can be change the way of life or the patterns of life, how they behave. So if you can take the unconscious matters into the conscious layers, then yeah, you will get kind of a relief, and it will support us to reduce the mental illnesses. So this is what the psychoanalysts believe regarding the mental disorders. So I think we were discussed. And the second type of therapy, cognitive therapy. So here they wanted to emphasize about the thinking pattern of the people, what people think rather than what they do. So here I think you can remember the word or the meaning of the cognitive word, the word cognitive. Cognitive is the cognitions, or we discuss different type of meanings for this cognitive word. So these cognitive skills, we know cognitive skills. So if you can remember the cognitive skills, there are different thinking abilities or the brain capacity. So using our brain, we engage different type of activities. So if I ask a question from you, can you list out some cognitive activities? Now I think you are familiar with this word. So please list out one or two cognitive activities. Can you? put few cognitive activities into the chat. Can you put cognitive activities? Okay, I can't see any answer. Okay, cognitive activities are if we take the word cognitive, so we use to explain our internal mental capacity, which means the activities that are controlled by our brain. So, what are the activities that are controlled by our brain? So, this is what we wanted to know. So, as a cognitive therapy, cognitive. So, cognitive activities are like thinking. Thinking is controlled by our brain. Memory or the intelligence. So problem solving. What else? Creativity. These are all these activities controlled by our memory. Brain. Creativity. Language abilities. Problem solving. What else? Problem solving, creativity, thinking ability, memory, concept formation. All these, there are some more activities controlled by our brain. So these, if we can focus our attention on those cognitive things. So if we can change the thinking pattern, if we can change our way of think, then that is the main reason for the mental illnesses. That is what the cognitive therapist opinion. So they emphasize what people think rather than what they do, because they wanted to show that the thing with the way of thinking may cause to the mental disorders. So they emphasize on our cognitive skills, cognitive uh, matters. So here, our perception, how we perceive the things, how we perceive our world may cause to the mental disorders. Perception or our thinking pattern of a person may cause to the mental disorders. So, according to our thinking pattern, then we behave on it. And dysfunctional thinking that leads to dysfunctional emotions. If it is not acceptable way of your thinking, dysfunctions, we don't accept those kind of emotions, then it leads to the dysfunctional emotion. So that then our behavior also may change accordingly. So thinking pattern is very, very important according to this cognitive therapy. So they wanted to change our thinking pattern. So they try to change our thoughts. So if you have the negative thought, you always behaving some kind of negative things, negative behaviors. You show the negative behaviors based on your negative thoughts. And we can change. Their belief was that people can change how they feel and what they do. So if we are able to change a thought, thinking pattern, then easily we can change the behavior. So that is what this cognitive therapist's opinion. They believe the emotions or the thinking pattern or internal cognitive ability matters causes to the what we call this mental disorder. So by changing the emotional pattern or the changing our thoughts, we can easily change the behavior. So this is the cognitive therapy. Here, people who believe this treatment method used approaches to change their emotions, change the emotions. So they wanted to talk to their emotions to change the negative behaviors. That is what this cognitive therapists did. This is the second type of therapy, cognitive psychoanalysis. And we call it cognitive behavioral therapy, kind of therapy, and how thinking affects the way a person feels and acts. So this is what they experience. They thought that how thinking affects the way of a person feels and acts. So thinking pattern may affect to the feelings and behavior. That is what they explain. And identify and change thinking and behavior patterns that are harmful and ineffective. So we may having different thinkings, and those negative thinkings or negative harmful thinking may affect our behavior or the thinking pattern. If you think negatively, the rays or some negative effects will be there into our behavior, and it is not it will be ineffective. It affect to our behavior, and replace them with more accurate thoughts. If we have the negative patterns or negative thinking, if we can change it in a more accurate way, and we can create a positive behavior, and it helps to change way of thinking about a situation. So the people can change the thinking pattern. If we can change the thinking pattern, then the way of thinking about the situation will we can change. Help to focus on current problems and how to solve them, because thinking leads our behavior. Then if we can change the thinking, then we can change the behavior also. Practice new skills, and we can train them to practice new skills, and we can address these kind of behaviors, depression, anxiety, traumatic disorders, eating disorders. If we can change the thinking pattern. So depression is also considered as a thinking changing of a thinking pattern, as well as there is a biological matters also. Anxiety means, you know, they don't have some fixed mentality, so they have some kind of changing mind, anxiety. And traumatic disorders, you know, trauma after happening some dangerous event, kind of war, accident, landslides, like some after facing traumatic event, our mindset may change. So then we need to address. Then we need to address to our thinking, the way of thinking. The way of thinking be the reason for the disorder. So if we take it negatively, අයියෝ මටමයි මෙහෙම වෙන්නේ, ඇයි මටම මෙහෙම වෙන්නේ, මගේ මොන හරි අඩුපාඩුවක් තියෙනවද, මම අපි එහෙම කියනවනේ මම හරිම අවාසනාවන්තයි, මටම තමයි හැමදේම වෙන්නේ, මං ගැන කවුරුත් හිතන්නේ නැහැ. අපි නෙගටිව් thoughts තමයි මේ ඔක්කොම. ඔන thinking pattern එකේ තියෙන negatives. මම කරන කිසි දෙයක් හරියන්නේ නැහැ, මම පාඩම් කරන දේවල් මට මතක හිටියේ නැහැ, කොච්චර මානසික මතකයෙන් මට ප්‍රතිඵල දැනේ වගේ අපි හිතන දේවල් තමයි කියනවා මේ කොග්නිටිව් දී අපි වෙනස් කරගන්නවා. ඒකට ට්‍රොමැටික් ඩිසෝඩර් එකක් අපිට වේදනාව ගෙන දෙන මොන හරි භයානක සිදුවීමක්. මේකට අපේ කොග්නිටිව් අපේ චිත්ත වේගයන් තමයි මේකට හේතු වෙන්නේ. ඒක වෙනස් කරන්න පුළුවන් නම් ඒක තමයි try කරන්නේ මේ කොග්නිටිව් බිහේවියර් තෙරපි, CBT තෙරපි. කොග්නිටිව් අපේ අපි හිතන පතන විදිය වෙනස් කරගත්තොත් දැන් අපිට පුළුවන් වෙනවා mental disorders, මේ minor type of mental disorders. මේ තමයි ඊළඟට ඉස්සරහට යන්නේ. ඒකට අපි හිතන විදිය වෙනස් වෙනකොට හිතන අපි negative thoughts අපි තියෙනවා නම් අපි හැම වෙලෙම බලනවා ඒ negative thinking එක නිසා අපේ body chemistry එක තියෙනවා. අපේ මොනවද තියෙන chemicals release කරන දේවල් තියෙනවා නම් ඒක වෙනස් වෙනවා. ඒකට තමයි අපි ඒක physically පෙන්වන්නේ, behavior එකෙන් පෙන්වන්නේ. අපි negatively හිතනකොට ඒක අපිට ලැබෙන්නේ කොහොම negative impact එකක් අපේ body එකට ලැබෙන බෑ. අපි හැමතිස්සෙම හිතනවා නම් positively. අයියෝ මේක අපි ගන්න ඕනේ. අපි පොදු කරන්නත් ඕනේ එහෙම. අපි සිත අපිට පුළුවන්. එතකොට අපිට අපි අර ඕරා එක කියන්නේ අපේ හිත තියෙන පොඩි රැස්සලක්, අපි මේ රැස්සලක් හේතු වෙන්නේ අපේ සිත. අපි හිතන විදිය. our cognitive skills. If our cognitive of the thinking, the way of thinking is positive, then it will work positively. If it is negative, then we may get bad results, negative results. So this is what the cognitive behavioral therapy. So depression, anxiety, traumatic disorders, eating disorders can be addressed by this cognitive behavioral therapy. අපි හිතන පතන විදිය වෙනස් කර ගන්න පුළුවන් නම් අපිට මේ ගොඩාක් රෝග, මානසික රෝග අපිට වෙනස් කරන්න පුළුවන්. ඔයගොල්ලෝ eating disorders අහලා ඇති. eating disorders වර්ග දෙකක් තියෙනවා. කෙනෙක් අධිකව කෑම කනවා, කෙනෙක් ඔය ස්ලිම් වෙලා ඉන්න ඕන කියලා වගේ හිතන අය කෑම නොකා ඉන්නවා. සහ බඩගින්නට කෑම කෑවත් ඒගොල්ලෝ ඒවා අයින් කරනවා, වමනිත කරනවා. එතකොට eating disorder එක සමහරුන්ට කන්න බෑ, සමහරු අධිකව කනවා, සමහරු කෑම කාලා ඒවා අයින් කරනවා. මොකද අර මේ එංග ගැන හිතලා. ඉතින් මේවා අපි හිතන විදිය අනුව තමයි ඒවා අපිට රෝගාබාධ විදියට අපි පේන්නේ. ડિප්‍රෙෂන් උත් එහෙමයි. අපි හිතනවා මට මේක දරා ගන්න බෑ, මට කවුරුත් ආදරේ නෑ, මම කරන වැඩ හැමදේම වැරදිනවා, මේක නම් මගේම කර්මය තමයි කියලා හිතන්නේ. මේක ඊට පස්සේ ඒක ඒ නෙගටිව් ෆීලිං එක තමයි අපිට හැම වෙලේම බලපාන ඉම්පැක්ට් එක වෙන්නේ. ඇන්සයිටිත් එහෙමයි. හරි සාංකාව, කාංසාව කියලා අපි කියන්නේ. අපි හිතන විදියෙන් තමයි හැමදේම දිරණය වෙන්නේ. මේවට ඊට පස්සේ හිතන විදියට නෙගටිව්ලි අපි හිතුවොත් ඒකට අපේ අර ඉම්පැක්ට් එකත් නෙගටිව් තමයි. බොහොම අපිට හමු වෙන්නේ නෙගටිව් රිසල්ට් එකක්. තිස්සෙම අපි හිතනවා ඉස්සර නම් අපි මොනවට හරි ඒවා කර්මයට බාර දීලා බලන් ඉන්නවා. අයියෝ මේක මං කාට හරි කවදා හරි කරපු දෙයක් තමයි. එතකොට ඒක නිකක් බොහොම පොසිටිව්ලි අපිට ගන්න පුළුවන්. මොකද එහෙම කරා නම් මම මේක මට විඳින්න වෙලා තියෙනවා. එතකොට අපි අර මහා නෙගටිව්ම හිතන්නේ නැහැ නැති වෙන්න පුළුවන්. අයියෝ මේක එදී ගණන් ගන්නේ නැතුව ඉන්න පුළුවන්. මේවා තමයි අපේ සිතුවිලි වෙනස් කරගන්න පුළුවන් ක්‍රම. cognitive behavioral therapy. ඒකට අපිට මේ අපේ සිතුවිලි වෙනස් කරන අපේ හැසිරීමත් වෙනස් කරගන්න පුළුවන්. සිතුවිලි කියන්නේම අපි හැසිරීම කියන්නේම සිතුවිලි වල පරාවර්තනයක් අපිට පෙන්නනවා. එතකොට මේක වෙනස් වුණොත් අපිට පුළුවන් වෙනවා අපේ හැසිරීමත් වෙනස් කරගන්න. ඒක තමයි second type of therapy. Next one, interpersonal therapy. We can use personal relationships to change the behavior, understand troublesome interpersonal issues. If we have some interpersonal issues, අන්තර්පුද්ගල සම්බන්ධතා වල යම්කිසි ගැටලු සහගත තත්ත්වයන් තියෙනවා නම් ඒකත් බොහොම negatively අපිට බලපානනේ, badly affect වෙනවා අපේ mentality එකට. Understand troublesome interpersonal issues. If we have this kind of interpersonal issues with friends, with our boyfriend or a girlfriend, interpersonal issues, we may experience unresolved grief. Grief is sadness. We have the same හිතා ගන්න බැරි දුකක් තියෙන පුළුවන් මේ interpersonal problems issues. අපේ අන්තර්පුද්ගල සම්බන්ධතාවයන් වල ගැටලු තියෙනවා අපිට හැමතිස්සෙම හිතා ගන්න බැරි දුකක් තියෙන පුළුවන්. Changes in social work roles. If we have the problems in our social life, then we may experience negative social roles and conflicts with others. හැමතිස්සෙම අනිත් අයත් එක්කලා ගැටලු ඇති කරගන්නවා. මේකත් අපි හොඳ ලක්ෂණයක් නෙවෙයි. මොකද interpersonal issues වල තියෙන ගැටලු අපේ mentality එකට බලපාන හැමතිස්සෙම. Help to learn healthy ways of emotional expressions. මේකත් interpersonal therapy එකක්. අපි හැමතිස්සෙම healthy ways බොහොම positive ක්‍රම තමයි හොයාගන්න ඕනේ emotions express කරන්න. බොහොම අමාරුයි. මම කියන අපිටත් මේක අමාරුයි. හැබැයි පුළුවන් නම් try කරනවා නම් අපේ ආගම් වලින් අපිට එක ආගම් වලින් අපේ ආගමට අනුව කියලා තියෙනවා. කොහොමද අපේ emotions express කරන්නේ? අපි අපිට හිතෙන දේවල් as it is අපිට කියලා දැම්මොත් එහෙම අනිත් කෙනෙක්ගේ හිතන දෙන්න පුළුවන්. ඊට පස්සේ අපේ හිතට එනවා. අපිත් ඒක ගැන හැමතිස්සෙම worried. එතකොට ඒක අපේ mentality එකට හොඳ නැහැ. So we want to learn how to express emotions positively or healthy way. දෙගොල්ලටම මේක society එකේ නම් අනිත් අයගෙත් හිත නොරිදෙන විදිහට work place එකේ නම් subordinates වගේ අපි followers වගේ එහෙම නැත්නම් superiors වගේ අපිට ඉන්න seniors වගේ හිත නොරිදෙන විදිහට කොහොමද අපේ emotions express කරන්න කියන එකත් අපිට එක විදියක් තමයි අපේ මේ therapy වලදී අපිට ගන්න මේගොල්ලන්ට කොහොමද කෙනෙක්ගේ හිත රිදෙන්නේ නැති වෙන්න අපේ emotions share කරගන්න express කරන්න. And we can teach or we can improve communications, the ways of communication. We can improve the communications, how to communicate our things. So this is also important. So interpersonal therapy to build up a good interpersonal relationship among the friends, among the relatives, family members, or the work among the workers. these small things are very, very important. Okay, and next therapy. Next type of therapy is the behavioral therapy. So use behavior modification techniques that apply for learning principles. So behavioral modifications techniques. So here the behaviorist school or behavioral psychologists believe that we can change the thoughts the other way around. The cognitive psychologists understood they express that we can change the behavior by changing the thinking pattern. Here, these people believe we can change the thinking pattern by changing the behavior. So they use this play therapy and breathing techniques to treat mental disorders or to change the behavior. By changing the behavior, they believe that we can change the thinking pattern. අපි සෙල්ලම් කරනකොට අපේ ඔළුවට නෙගටිව් thoughts එන්නේ නේ අපි කරන දේවල් වලින් අපේ සිතුවිලි වෙනස් වෙනවා. ඒක තමයි මේගොල්ලෝගේ අදහස behavioral therapies. Use behavior modification. So they use to change the behavior. Try to change the behavior. Then the thinking pattern will change. So breathing techniques, inhale and exhale. Meditation වලදී කරන්න. අපි කියන එකට ආනාපාන සති භාවනාව. Inhale කරනවා අපි සිහියෙන් යුතුව අපි හුස්ම පිට කරනවා exhale කරනවා. Inhale and exhale. Breathing techniques. අපි ඒකට කියන simple relaxation technique. ඊට පස්සේ play therapy. Play therapy. අපි කුඩා ළමයින්ට බහුතර භාවිත කරන මේ behavioral technique එක ඒගොල්ලොන්ට යම්සි දෙයක් අපිට පාවදන්න ඕන නම් play therapy. ඊට පස්සේ behavior එක change කරන්න අපිට පුළුවන් කියලා අපි කියන breathing techniques. අපි ඒකට concentration. අපි hyperactive students එහෙම අපේ ඉන්නවා ඒගොල්ලොන්ට that they cannot concentrate on one thing. Hyperactive. ඒ කියන්නේ ඒගොල්ලෝගේ biological system එකම change වෙලා තියෙන්නේ. එක තැනක ඉන්න බෑ, concentrate කරන්න බෑ, focus කරන්න බෑ. ඒගොල්ලෝගේ attention perception ඒගොල්ලෝ biologically බොහොම අධික්‍රියාශීලී. ඒක ඉන්නේ physical malfunction එකක් විදියට. එතකොට මේගොල්ලෝම ගොල්ලොන්ගේ හයිපර් ඇක්ටිවිටි අධික්‍රියාශීලීත්වය අපි හොඳ කරන්න නම් මේ එක જાති ක්‍රීඩා ක්‍රම තියෙනවා play therapies ඊට පස්සේ breathing technique concentrate කරන්න එක තැනක වාඩි කරලා තියන්න ඒගොල්ලොන්ට එක techniques අපිට තියෙනවා එතකොට මේවෙන් පුළුවන් මේගොල්ලෝගේ හැසිරීම පාලනය කරලා අර root cause එකට treat කරන්න Aversion therapy used for maladaptive behavior. Maladaptive behavior. And adaptive behavior we accept that behavior, but maladaptive behaviors we do not as a society or yes as an individual we do not accept that kind of behaviors in the society. In a family, maladaptive behaviors, sometimes smoking, drinking, engaging some unusual sex behaviors, sex active, those are maladaptive behaviors. So we use the aversion therapy, that is also called behavioral therapy, aversion. Aversion means once the thought on smoking comes, then we give some what we call what is it punishment when some thought comes, then we punish the people. That is aversion therapy. අපිට මොන හරි දුම් බොල්ල කල්පනා වෙනවා නම් ඒ වෙලාවට දඬුවමක් දෙනවා. මොන හරි punishment එකක්. ඒක සිතුවිලි එනකොට ඒක තමයි control කරන්නේ. නැත්නම් සිතුවිල්ල එන වෙලාවට යම් කිසි දඬුවමක් දෙනවා ඒකට. treatment එකකට. ඒක ඒ දඬුවමට බයේ මේ behavior එක නැතුව යනවා. මේක aversion therapy එකක් කියලා කියනවා. එපා කරවීම. aversion means එපා කරන කරන්න එපා කරවීමක් කරන්න. ඒකට මේකෙන් අපි හැසිරීම වෙනස් කරන්න try කරනවා. Negative or unaccepted behaviors can or maladaptive. Unacceptable means maladaptive behaviors can be changed using this aversion therapy. Okay, smoking, drinking, negative behaviors or hyperactive behaviors. Hyperactive child. If you have a child in the classroom or in the family having hyperactive behaviors, so then we can neglect their behaviors. Neglecting is also a negative aversion therapy. අපි ගණන් ගන්න එපා කරනවා එතකොට යාට. යා නිතරම අඬන ළමයෙක් නම් අපි ඒකට ඒක ගණන් ගන්න නැතුව වෙනවා. behavior එක change කරනවා. මේ මැදම නැත්තම් අපි ඒකට attention නොදී ඉන්නවා. මේ වගේ therapies වලින් අපිට ඒක treat කරන්න පුළුවන්. is behavioral therapy. behavior එක change කරනවා. දඬුවම් අපි behavior එක change කරන්න අපි behavioral psychologist වරුන් පාවිච්චි කරා. අපි අක්තිව උත්තේජන motivational techniques පාවිච්චි කරනවා. එහෙම නැත්නම් reinforcement. මේ උත්තේජන negative හරි positive හරි උත්තේජන වලින් behavior එක change කරන එක තමයි මෙතනදී වෙන්නේ. අපි සමහරවිට හොඳ දෙයක් කරොත් අපි සත්තු එහෙම train කරන්නේ. ඒගොල්ලන්ට දෙනවා මේගොල්ලෝගේ behavior එක change කරන්න අපි ඒගොල්ලන්ට දෙනවා එක incentives. අපි zoo එකේ elephant show එක දක්වනවා. එතකොට ඒකේ ඒගොල්ලෝ ඒ විදිහට හැසිරෙන්නේ ඒගොල්ලන්ට incentives දෙනවා. clap කරන්න ඕනේ ඒගොල්ලෝ එතකොට හරිම happy. incentive එක. එහෙම නැත්නම් පළතුරක් දෙනවා. මේක train කරන්නේ මේ විදිහට. ඒ වගේ තමයි මේ behavioral therapy එක. අපි positive හරි negative හරි techniques පාවිච්චි කරනවා. positive way ඒ කරන වැඩේ කරගෙන යන්න ආධාරයක් අපි දෙනවා. negative නැත්නම් aversion therapy එකේ අපි ඒක එපා කරනවා. ඒක නතර කරනවා. ඒක තමයි අපි treatment එක දෙන්නේ. එතකොට aversion therapy එක reinforcement වලින් අපිට change කරන්න පුළුවන් මේ behavioral therapy එක. Then the fourth approach is humanistic therapy. It emphasizes people's capacity to make rational choices. So humanistic. So they believe the strength of humans. They believe the strength of human because as a human you may have the ability of changing your behavior, changing your thinking pattern. You are the person who can think on it. So this humanistic approach, they emphasize people's capacity, humans' capacity to make rational choices. So we use that to change our behavior. අපි තමන්ගේ ශක්තිය, තමන්ගේ ability එක පෙන්වන්න කරලා දෙන එක තමයි මේ humanistic approach එකෙන් කරන්නේ. Develop their maximum potential. So we can show their maximum potential. So we can emphasize the abilities of a human. It is we call it client-centered approach because we ask them to explore their abilities. We ask them to explore their abilities. මොනවාද ඒගොල්ලන්ට තියෙන දක්ෂතා කියලා explore කරන්න. විවරණය කරගන්න අපි අදහස දෙනවා. ඒක අපි කියනවා client-centered approach. So no one can give the solutions of clients' problems. The person who is suffering with the mental illnesses or the depression or anxiety can find the solution of their problem. Only the counselors or the psychotherapists can show the path or show the way how to find the solution. That can be done. This method considered a client-centered approach because the person who is suffering with the mental illness should find the solution for those. Therapists help client to change by emphasizing their concern. So we can change their thinking pattern and emphasizing their concern. So we can ask them to change the concerns, care and interest. So we can direct their thoughts, views into a systematic way or positive way. It පෙන්වන්න පුළුවන් හරි හරියට පැත්ත. හරි මෙන්න මේ විදිහට කරොත් නම් පොඩ්ඩක් හොඳ වෙයි කියන එක පෙන්වන්න පුළුවන්. But they have to uh, solve their own problems by themselves. So this is the humanistic therapy. So here they should believe themselves or their abilities. අපිටම තමයි කරගන්න වෙන්නේ. අපි තමයි අපේ රුචිකත්වයන් දන්නේ, අපේ දක්ෂතාවයන් දන්නේ, අපිට මොනවද කරන්න පුළුවන් කියලා දන්නේ. මගේ තියෙන weaknesses දන්නේ මමයි. ඒකට පොඩි support එකක් දෙනවා. මේ විදිහට අපි හිතුවත් change කරගන්න පුළුවන් කියන එක. හැබැයි බාහිර පුද්ගලයෙකුට කරන්න පුළුවන් දෙයක් නෙමෙයි. ඒක අපිටම තමයි ඒක කරගන්න වෙන්නේ. අපිට ඒ හැකියාව තියෙනවා. ඒකට ක්‍රමක්‍රමයෙන් කෙනෙක්ව ලං කර ගැනීම තමයි මේ humanistic therapy එකෙන් කියන්නේ. ඒවා ටෙක්නික්ස් තියෙනවා. අපි ඒව ફોકસ කරනවා එයාට ළඟා කරගන්න ඕන තැනට අපි ටාගට්ස් දෙන්න පුළුවන්, අචීව් කරගන්න ඕන ඔබ්ජෙක්ටිව්ස් අපිට එන්ඩුමිනල දෙන්න පුළුවන්. ඒවට යන ෂෝට් මෙතඩ්ස් අපි කියලා දෙනවා. මේ වගේ දේවල් කරනවා. අපිට තියෙන ගැටලුව විසඳ ගන්න පුළුවන් වෙන අපේ දක්ෂතාවයන් ඒකට වර්ධනය කරගන්න කොහොමද කියන එක අපිට මේ humanistic approach එකෙන් කතා කරන්න පුළුවන්. Okay. Other type of therapies. Those are the basic therapies. Other type of therapies. Here, first one is you can see an animal, a dog with an old lady. So this considered as a very good therapy. So you know, in Western countries, they take care of animals and they are the loved ones. They live with them. Sorry. Excuse me. Animal, we call it animal assisted therapy. It's a real therapy. If you have an animal as a pet, you may feel this therapy, animal assisted therapy, working with dogs, horses or other animals to bring comfort, help with communication and help cope with trauma. So these elderly people, if a person suffered with traumatic situations, so this animal support to get rid of those symptoms. අපි ආදරය කරන්න සතුන්ට ආදරය කරන්න ඒගොල්ලෝම ආදරවන්න ගන්න. ඒකට අපි අර ඉන්න mental situation එක වෙනස් කර ගන්න පුළුවන්. මේක හරිම වටිනවා. දැනටත් මේක තෙරපි එකක් විදිහට පාවිච්චි කරනවා. Next one, creative arts therapy. Use of art, dance, drama, music, and poetry therapies. So if you are suffered with some problems, then you can engage these type of activities. You can draw a picture, use of arts, sing, dance, drama. You know aerobic exercises. Have you heard the aerobic exercises? Aerobic. You dance with the music, with rhythm. So it support us to change our mentality. Aerobic. music can change your behavior. Exercises, dance, drama, engaging drama, dramatic things. So solve your problems. And music and poetry therapies. All these are considered as a therapy. So creative art therapy is also considered as a one kind of thing. There's another last thing, play therapy. So help children. You can identify and talk about their emotions and feelings different. You can work with them. It's a different activity. So normally teachers know about this. Later, we can work with them and it helps them to identify their feelings and their emotions. We can talk with their emotions, and the feelings. This is another kind of therapy. You can talk, you can discuss about it, them, about their emotions with them. Animal assisted therapy, creative arts therapy, and play therapy all are taken to treat mental disorders. So these are the things that we have to discuss under the therapeutic side. So all these treatments are taken into the consideration when it comes to the treatments to the mental disorders. Treatments to the mental disorders. So I have briefly explained these therapies because you actually you have to have some idea about these therapies. Otherwise, you are not going to treat to the patients. So, you, basically, you have to know this type of therapies are there. So that is the opinion of this lesson. So, if you have any question, you please ask about this session. Do you have any question? No. Okay. Okay, I just show you, I will, normally in the classroom, we do this simple relaxation. It's called simple relaxation. Simple relaxation. So if we want to relax ourselves, we can use relaxation technique. So I will we have only one session to complete. I think from next week we can finish. And for this treatment, you know the meditation. You will learn the meditation sides, but this is not a meditation. I just show you, because if we are in the face-to-face classroom, we normally do this we call it simple relaxation. This is practiced by the counselors to relax the people. Relax. You know what relaxation is? So this is, I think you can see the screen. Uh, these are the steps. So probably you can do this. You can do the, simple relaxation. So we'll have 10 minutes to do this. So if you so then you can practice this individually. Okay, I will show how to practice this. Okay, then you can relax yourself, right? Just try. Just this is the benefit of simple relaxation. The key to deep breathing. The deep breathing is we call simple relaxation. Deep breathing is to breathe deeply from the abdomen. You know what the abdomen is? අපි abdomen එක අපේ බඩ අර යටි බඩ උදරයේ යටි කොටසටම යනකල් අපි හොඳට හුස්ම ගන්න ගන්නවා, හුස්ම තද කර ගන්නවා, getting as much fresh air as possible in your lungs. So you will get the fresh air into your lungs. When you take deep breaths from the abdomen rather than shallow breaths from your upper chest. Normal breaths you take to your upper chest, we call it shallow breaths. You inhale more oxygen. You inhale more oxygen if you take deep breaths. So the more oxygen you get, the less tense, short of breath and anxious you feel. You know, if you concentrate on your breathing, exhale and inhale, you may feel less tense. Relax tension short of breath may lead to the anxiousness. Short of breath. Oxygen අඩුයි. එතකොට ඒක අපේ ටෙන්ෂන් එක වැඩි වෙනවා. anxious වෙන්න පුළුවන්. අපිට feelings not good. So this is the what we call scientific side of the breathing exercises. අපි හොඳට exercise කරනවා නම් breathing exercise එක මේක තමයි reason. අපිට හොඳට oxygen හම්බ වෙනවා නම් abdomen එකටම යනකම් කියන්නේ අපි chest එකෙන් විතරක් නෙමෙයි හොඳට අපි කියන්නේ බඩකට පුරා හුස්මක් ගන්න කියලා හොඳට හොඳ දිගු හුස්මක් ගන්නවා නම් ඒක අපිට වටිනවා. අපේ ටෙන්ෂන් එක අඩු වෙනවා. So shall we try a few minutes to have simple relaxation, which is called simple relaxation. But I can just ask you to do this, engage with the simple relaxation. This is considered as a systematic way of psychological treatment. අපි simple relaxation එකක් අපි හොඳට මේක ඇති ඕනම කෙනෙකුට තනියෙන් කරගන්න පුළුවන්. මහන්සි වෙලා ස්ට්‍රෙස් වෙලා ඉන්නකොට බස් එකේ යන වෙලාවට උනත් ස්ට්‍රෙස් වගේ නා මේ සිම්පල් රිලැක්සේෂන් එකෙන් අපිට පොඩි පහසුවක් එනවා අපේ මානසිකත්වයට. අපි බලමු දැන් මේක පොඩ්ඩක් කරලා. ඔයගොල්ලෝ නිදා ගන්න නැතුව තව එක දවසකින් ඉවර කරන්න පුළුවන්. ඒ නිසා අපි ඇඩික්ෂන් ටොපික් එකට යන්නේ නැතුව මේ ඕකේ addiction topic එකට යන්නේ නැතුව අපි අද මේක කරමු. ඔයගොල්ලෝ මේක තනි කර නිදා ගන්න ඇඳට ගියාම මේක ප්‍රැක්ටිස් කරන්න පුළුවන්. වැඩ ගොඩාක් තියෙන වෙලාවට ස්ට්‍රෙස් අඩු වෙනවා, ටෙන්ෂන් එක අඩු වෙන්න පුළුවන්. අපි මේක simple relaxation කියලා අපේ මේ කවුන්සලින් වලදී අපි පාවිච්චි කරන්නේ simple relaxation කියන වර්ඩ් එක. අපේ religious activities වලදී අපි මේකට කියනවා ආනාපාන සති භාවනාව ප්‍රගුණ කරනවා කියලා. එතනදී අපි focus එකත් යනවා අපේ mental focus එකත් මේ අපේ breathing කියන එකට අපි try එකක් දෙමු. ඔයගොල්ලෝ comfortable විදියට වාඩි වෙලා ඇස් දෙක පියාගන්න. මට පේන්නේ නැහැ ඔයගොල්ලෝ හරියට කරනවද කියන එක. but we will try ඔයගොල්ලන්ට දැනේ මොකක්ද දැනෙන වෙනස කියලා මේක ඊට පස්සේ practice කරන්න. මම මේකත් දානවා LMS එකට. එතකොට ඔයගොල්ලන්ට මේක කියලා කරන්න පුළුවන්. I will explain how to do it. Okay. Okay, then shall we start this? Okay. Okay. First, you have to sit comfortably. So maybe you may lying down in a bed, doesn't matter, but you have here for practicing, you have to sit comfortably with your back straight. Back straight, you know what the back straight, your back side should be straight. You have to sit comfortably. කොහොම පහසුවෙන් වාඩි වෙන්න හොඳ කෙලින් තියාගෙන පහසුවෙන් හොඳ කෙලින් තියාගෙන put one hand on your chest, on your hip, and other on your stomach. You know what I ask you to do. I can't I can show you, but it is not appropriate. You have to put your one hand on your chest. පහුව උඩ එකක් තියාගන්න හොඳට හදද ස්පන්දනය වට දැනෙන්නේ. The other hand on your stomach. අනිත් අත අපේ බඩ stomach එක උඩින් තියාගන්න. Breathe in through your nose. අහනෝ ඉහළ හුස්ම ගන්නවා, not on your mouth. Breathe. So close your eyes. Straight. Sit comfortably. And your backbone should be straight. Put one hand on your chest and the other hand on your stomach. Right? And close your eyes smoothly. Let the eyes close. Then you have to concentrate on your breathe. Breathe means husma ganne එක. So breathe in through your nose. නොහයින් තමයි හුස්ම ගන්න. The hand on your stomach should rise. එතකොට අර අපි කිව්වේ abdomen එක තද වෙන්න එක ඉස්සෙන්න ඕන. හොඳට කකුලට තද හුස්මක් ගන්න ඕනේ. මේ එතකොට බඩ දිහාට මේ හුස්ම absorb වෙනවා. එතකොට stomach should rise. මේක අත උඩට එන්න ඕනේ. කියන්නේ ඒක oxygen යනවා කියනවා. The hand on your chest should move very little. ඒකට මුකුත් වෙන්නේ මොකද? බඩට තමයි හුස්ම වදින්න ඕනේ. හරි? The hand on your stomach should rise. The hand on your chest should move very little. ඒක චරම ලොකුමකට වෙන්නේ නැහැ. හරි? Breathe in. එතකොට breathe out. Then breathe out. Exhale. Exhale means inhale and exhale. Exhale through your mouth. ඉස්සෙල්ලා හුස්ම ගන්න නහනේ through your mouth. Then හුස්ම පිට කරන්න. Exhale through your mouth. හුස්ම ගන්නවා කියනකොට circulate වෙනවා ඔයාගේ internal organs. Pushing out as much air as you can while contracting your abdominal muscles. අතට මේ බඩේ තියෙන muscles අකුලනවා contract කරනවා. අකුලගෙන හොඳට අර ගත්ත හුස්ම පිට කරනවා. The hand your stomach should move in your as you exhale. හොඳට හුස්ම පිට කරනකොට මේක ඇතුළට තද වෙන්න ඕනේ. But your other hand should move very little. පපුවට ලොකු දෙයක් උඩ chest එකේ තියෙන hand එකට මුකුත් වෙන්නේ නැහැ. Continue to breathe in through your nose and out through your mouth. Try to inhale enough so that your lower abdomen rises and falls. Count slowly as you exhale. තේරුණාද මොකද්ද කරන්න කියන එක? හොඳට පපුවට දැන් මම හිතන ඔයගොල්ලෝ අත තියාගෙන ඉන්නවා. ඇස් දෙක පියාගන්න. හොඳට හුස්ම ගන්න inhale කරන්න, breathe in, breathe out. This is the exercise. You should breathe in using your abdomen and through your nose. First breathe in through your nose and store the air in your abdomen and slowly you exhale or breathe out using your mouth. That is the exercise. So now you can start it. Breathe in, close the eye, breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Concentrate on your breathing process. Concentrate how the air flows through your chest. Concentrate how the feelings. Concentrate on your feelings. Okay, now you slowly open your eyes. We have did this for 5 minutes. How you feel? I think you may feel some comfortable feeling before we were, because we had enough oxygen. We got more oxygen into our body, so it will reduce our bad tempers, our stressors. This is very good exercise. If you want to concentrate on it, it's very good. This we call it simple relaxation, and there's a deep muscular relaxation. We call it SRM and DMR, deep muscular relaxation. So once you become an expert of this simple relaxation, we mean simple relaxation means that we did this simple relaxation, breathe in and breathe out exercise, so you can concentrate on it. So this is very good exercise if you can practice it daily basis, daily mean in the early in the morning and when you go to the bed or when you go to sleep, so you will get a good sleep. So this is very good exercise. I think you feel it now. You know how to do it. So sometimes you may find it difficult breathing from your abdomen. It's very difficult sometimes. You may feel ලොකු බඩක් එහෙම තියෙනවා නම් හරි අමාරුට rising down. අත අද ගන්න හරි අමාරුයි. Your abdomen while sitting up. වාඩි වෙලා එක කරන්න අමාරු නම් try lying down. When you are in the bed, you can do this easily. Put a small book on your stomach. Sometimes no need to put your hand. You can put the book on the stomach and breathe so that the book rises as you inhale and falls as you exhale. So you can see the difference. You can practice this exercise. You can practice this exercise as you wish. No need to sit down, but you can try it lying down, okay? Lying down. So this is called simple relaxation. Very easily you can do it, but the benefits are more. More you can have more advantage of this simple relaxation. We don't call this as a meditation. This is a simple relaxation. This is a treatment that can be used to relax the people. If you are in a bad or the temper, bad temper, ඔයාලට ප්‍රශ්නයක ඉන්නවා නම් ගැටලු විසඳ ගන්න බැරි අවස්ථාවක නම් bad temper එකක් හරි නැත්නම් මේ වෙලාවේ ඔගේ mentality එක you can do this activity, you can do this engaging exercise, so it will give you some the benefit of relaxing. You feel relaxed mood, your emotions may get relaxed. So if you are in a stress mood, if you are in very tempered mood, this exercise will reduce your stress for the temper. So this is called simple relaxation. So you can practice, right? So 9:50, and we have time. So I will. So if you have any question, please raise. Any question? No, I think no questions. No. Okay, let me see. Okay, thank you. Okay, we have only one topic to cover. I think next week I can complete this addiction one. Okay. If you have any, this is our next topic. So addiction. If you don't have any questions, I think we'll